Hi, I'm Kim. I would like to talk a little bit about using narrative therapy to work with teenagers. And to begin with, when a client comes, whether they come in a school setting or in a private practice, there's often a temptation to ask about what are the goals for therapy and so on. Whereas we can ask what might be important for me to know so we can work well together. So if you ask about goals, sometimes people can, make up something that seems to fit the bill. But we want to really invite the person to begin thinking about themselves and their story, because that's how the word narrative therapy came to be. It's the stories the clients share. We can ask, what helped in the past if a problem is identified. By doing that, we place the client as the expert. Even if they've tried a lot of things and nothing's worked, we can say, well, which were the most unsuccessful? We can ask really crazy questions like that because they'll often reveal something about the person, and we really need to get to know the person and their identity and how they make decisions and how they see the world. We want to look at the history of the problem. So, for example, if a client says, well, I've got this thing called anxiety and so on, we'll say, well, is that something that you notice was creeping in there when you were even in grade 3 or 4? So we're looking at the history of this, or we might even say, if you look at your ancestors, your grandparents and your parents and your older siblings or aunties, do you think this problem, this anxiety problem's kind of been in the family for a while? Maybe you might even have been born into a family where anxiety had its roots, it was really embedded in this family that you've been born into. Because that can also help reduce the shame, because a lot of young people feel that they're letting their family down or themselves down if they themselves are succumbing to this thing that we commonly call in the 21st century anxiety. But we also want to see if we can name anxiety that's a bit more experience near. So I often keep problems in the plural. So rather than saying this anxiety, I might say these anxieties, do they come at a particular time of day and so on. I'm assuming that anxiety has different kind of cloaks that it wears at different times of day, different days of the week and so on, and in different social settings. So if the presenting problem is anxiety, we can ask, what kind of anxieties are you struggling with? And what do these anxieties do to your life? How do they impact your day-to-day living? Is there a particular time of day or a day of the week where these anxieties kind of spoil things, We can also, I use the phone a lot. I'm always getting my phone out in sessions and Google searching things. So, the kind of things I might Google search in this instance is, what are the typical symptoms of anxiety? And I'll get the young person to do the same, or we'll look at it together and we might make a list. So we'll write on a whiteboard or a piece of paper on the Zoom whiteboard things like indecision, avoidance, negative self-talk, racing heart, trembling, constant worry, dread, bracing for danger, difficulty focusing. We just make a list and then we're able to say, well, what are the top 3 of these that are in your life at the moment? So we're already externalising some of these things by saying they're in your life at the moment. I'll often actually say, today's the 20th of May, 2026. Which of these are in your life at the moment? Of course, if people are trained, counsellors are trained to use CBT, they kind of will do that challenging of these negative self-talks. And so what is it like really if you are sitting there on the other end of in a session and being challenged by the therapist or the counsellor? Really, CBT, is designed with this cognitive dissonance to create discomfort, actually, in the client, because the idea is to highlight the gap between a person's belief and their behaviours. Trying to make sure the person's, behaviours align with their beliefs and that they're rational and so on. So, in narrative therapy, we particularly avoid CBT because we want the client to be the expert in their life. And we want to find out who this person is. So we might draw a picture with some speech bubbles of these negative self-talk, for example, if that's one of the top 3. And they might write down some of these phrases or statements that are in their mind. And then we might say, well, look, if we were to pick one and talk about that today, which would be the helpful one, do you think? And a common one, as many of you will know if you're working in schools, for example, is I'm not pretty enough. And so we could do an online search. Again, I grabbed my phone and I said, I'm interested in the statistics, the global statistics of that concept of not being good enough, not being pretty enough, or whatever it is. So what shall we put in the search engine? Okay, not being pretty enough. And then, boom, we get these statistics, and it's very exciting because, again, we're externalising the problem, but we're also looking at the origin of the problem. Young people often think they're the origin of the problem, but for example, with that research into the Google around the prevalence of appearance dissatisfaction, we've got 90% of teenagers express some level of concern about their body image. 93% of Gen Z compare themselves via social media. 41% say that this is a high level of concern for them. And then we can talk about, so we're looking at a global issue. We're not looking at some problem that is some kind of weakness in you. It's something that's affecting a lot of girls at the moment. And then we can do this exploration. So we're looking at social discourses, social constructs. 32% of females report being satisfied. So a third of the females report actually being satisfied. Well, 2/3 are not. So we can say, is that a good thing or not so good thing, or in between, bit of both? What does that really mean? What does that really mean? So we have a discussion about a third of women being happy with their self-image. And really we're coming to a perspective where the person starts to see that they are not the originator of this problem. In fact, one of the lovely things is to do an even deeper dive. Historically, some of the people might have seen, films like Jane Eyre or Little Women and things like that. And, 1847 in Jane Eyre, Jane's worried about her plain features, lack of physical attractiveness. And she also has this comparison to some idealised picture of others. Little Women, 1868, Meg has that concern about the shape of her nose and uses a peg to try and change the shape of it. So we're looking at, centuries of superficial expectations placed on women's appearance, but it goes back even before that. So, in the Odyssey, Penelope is told by her son to stop talking and go up and be with the women. It's the men's business to talk. And then we've got the Greek myth of Pandora. Zeus, created Pandora, and Pandora is, through the story, is said to be the originator of all the evils of the world. That's like 7 centuries BCE. And then you've also got Aphrodite, this, the goddess of beauty, and there's the Persian Anahita. She's a goddess where there's this idealized standard of how a woman should look. So these conversations, whether you call them philosophical or existential, but they're very real and they need to be part of therapy with teenagers.